I'm Renu Tipirneni. I'm a physician and researcher in the medical school, and my focus is on the intersection of health policy and health equity. I have been at the University of Michigan for 10 years now, on the faculty for 8 of those years after doing a postdoctoral research fellowship. I am really excited to talk to you because I'm looking to work with people who enhance the reach and quality of the work I do, and I think you could be one of those people. I've had a great relationship with the Institute for Social Research, including the Survey Research Center, since I started here. I really love the collaboration that we see across people from different disciplines. So a little bit about my background. I'm a general internal medicine physician, so I see patients both in primary care and in the hospital when they're sick enough to have to be admitted there. And my research focus on health policy has two broad buckets. One is around health insurance policy, thinking both about Medicaid coverage for low-income individuals and families who qualify, and also Medicare coverage for older adults and those with specific disabilities and low incomes that qualify. I am really interested in how we can improve the quality of care those programs deliver as the two major public health insurers in this country, and on the equity of the care that they deliver, both overall in the country, as well as at the state level, where there are a number of policy factors that influence who can get those types of coverage, particularly for Medicaid, and at the plan level, because a lot of these plans are delivered through private managed care plans. Outside of the health insurance policy space, my other interests are in identifying and addressing social determinants of health, specifically unmet social needs in clinical care settings. I think those from a public health, sociology, or other social science backgrounds really have an understanding for how social and behavioral determinants are huge factors in terms of determining people's health outcomes and equitable health outcomes. But in medical care, this is somewhat of a newer concept. And so I'm really interested in bridging those worlds. And some of my work in this space has been in developing quality improvement initiatives that specifically address health equity and specifically identify and address unmet social needs when we see patients in clinical care settings. A little bit about the research involved that could be an opportunity for diversity supplement and collaboration and mentorship is around one of my large grants focused on the Affordable Care Act and how it may influence disparities over the life course in middle-aged and older adults. My focus for this project has been thinking about equity across race and ethnicity, specifically how people's ability to get an Affordable Care Act plan in midlife can potentially affect how they have health outcomes later in life as older adults. So under the Affordable Care Act, there was a big expansion of insurance coverage, primarily through two pathways. One was through Medicaid expansion, which states can take that option to use to expand eligibility, mainly for non-elderly adults ages 19 to 64. Many states have taken that option and some states still have not. So this leads to differences in how people can get eligibility for Medicaid coverage. There's also been an expansion of private insurance through individual marketplace plans that people can get through healthcare.gov or similar state-based platforms. And that's available in all states and is especially a good opportunity for people who live in states that have not expanded Medicaid, but still have lower incomes and need financial assistance. So I've been very interested in what happens. You know, there's been a lot of work done in this space to understand the effects of the Affordable Care Act. Somewhat less attention in terms of how it has affected older adults or how potential exposure to these plans in midlife can affect aging into older adulthood. So this specific project looks at exposure to Affordable Care Act plans, both Medicaid and private insurance in midlife, and follows those individuals through to see how this may affect health and healthcare outcomes later in life. So some of the outcomes I'm interested in are health insurance coverage, access to healthcare, and specifically self-reported health outcomes, things like overall health status, how people can functionally live their lives, like activities of daily living, things like that. I'm also interested in how this affects their utilization of healthcare through things like hospitalizations, needing to go to the emergency department, needing to get special types of care, whether those people need more or fewer medications. So I'm really interested in how this policy can not only have an effect on equity of outcomes by race, ethnicity at the point in which people get that care, but how that may affect trajectories of how people do as they age across the life course. So if you're interested in any of these topics, health policy, health insurance policy, sociology of the life course, structural racism and discrimination, I would love to hear from you. And thank you for considering this.